Most complications in cancer patients follow a pattern, and a lot of the time that pattern comes down to one thing: the immune system is not working the way it should. At a basic level, the body relies on white blood cells to fight infection. These cells are constantly identifying and destroying bacteria, viruses, and other threats. So when those cells drop too low, even normal everyday bacteria can become dangerous. Next, we're going to talk about neutropenia. Neutropenia basically means low neutrophils. Neutrophils are a type of white blood cell that play a major role in fighting infection. So, when neutrophils are low, the body loses one of its main defenses, and that creates a high risk for infection. The most important sign to watch for is fever. Even a low grade fever matters because in this situation, fever may be the first and only sign of infection. There may not be redness, swelling, or obvious symptoms, so a temperature change becomes critical. Here's the nursing priority. It all revolves around a primary goal: prevent infection. So, to do that, we focus on limiting exposure and maintaining a clean environment. You'll see things like strict hand hygiene, limiting visitors, especially if they're sick, using a private room when possible, monitoring temperature regularly. There are also restrictions on things that can carry bacteria. So, patients are often told to avoid raw fruits and vegetables, undercooked foods, fresh flowers or plants, because these can introduce bacteria that the body can't effectively fight off. This all ties back to the same idea. Low neutrophils is reduced defense. Reduced defense causes an increased infection risk. So everything we do is built around protection. So when you step back, this is a system. White blood cells protect the body. When those drop too low, the risk shifts dramatically. And instead of reacting to infection, we focus on preventing it entirely. Let's test this quickly. Low neutrophils, what's the main risk? Infection. What's the most important sign to monitor? Fever. What is the priority? Prevent infection.